I work at Essentia Health, St. Mary's.
I'm in the surgical technologist apprenticeship program.
As a surgical tech, it is my job to maintain and set up a sterile field. I assist the surgeon during the operation, and I also make sure all of our instruments and tools are all ready and prepared for the field.
So I will show up in the morning, check what kind of cases we have going on for that day, go check our case carts, make sure we got all the proper supplies for each case, then help set up the room, open everything, get it organized, and assist the surgeon wherever they need me for the case.
Apprenticeship program is a 12-month program, or 2,000 hours, and the apprentice learns how to perform surgical technologist duties within our operating rooms. So they're working in conjunction with our entire surgery team. In the end, they will be able to do any kind of surgical service that would be equivalent to somebody coming out of the associate degree program out of the state of Minnesota.
One way that the apprenticeship is different is that this is an on-the-job learning-as-you-go program. In other words, it's deeply immersive. Our apprentices are here 5 days a week, 7 to 3:30, and then they do their studies afterwards.
I am definitely a hands-on learner. I don't do very good within the schools, so having this apprenticeship style learning has been very beneficial, especially hands-on, learning it right then and there in the job.
To be able to take what I learn and then go in and use it immediately, or even just you learn something from your preceptor that day and you immediately go into the next case and use it. I feel like that helps me remember it a lot better.
Registering our surgical technologist program allowed us to take the approach of having a standard framework. With this particular program, we wanted to make sure that it had the integrity or backing of having it run through a registered program.
Being in surgery can be very intense, and when they begin that role, it's almost an intimidating type of presence to go into an operating room. As they grow, you see that confidence and they're able to function, they're able to help our patients, they're able to help nurses, they're able to help anesthesia. That's the biggest part where I see the apprentices growing in this throughout the year.
This apprenticeship has helped me further my medical career because it brought me into this position when I was an aide, and it's exposed me to a lot more positions that are in surgery and career pathway possibilities, and it's been a great part.
One piece of advice that I think is helpful for businesses who are going to be looking or exploring apprenticeship programs to understand is that there's an important piece of partnership both internally within an organization and then externally, and that there are many organizations to help, including the Department of Labor and Industry, and then other organizations throughout the U.S. with HCAP that can help you get started.
I'm a part of the support network for these apprentices, as is their instructor, as is every nurse, every tech, every preceptor that they come in contact with in the OR. We've seen tremendous growth and response from our employees when we do have job postings for the apprenticeship program.
I like the variety of it, and just being able to assist in any way I can. It's fun.
Every day is something different, different surgery, different crew, different story. It's just a whole lot of learning, and that's what I love about the job.
People here at St. Mary's are really great, and it's been pretty smooth, and I enjoy just the job in general.